Welcome to the Sweaty Pillow. I'm so excited, and I've been looking forward to this particular guest, Dr. Anat Sapan, who is just her background is so impressive. We're so lucky that you're giving us this time today. And I'm going to read it out because it really is, it's not something I could remember because it's so impressive. You're a board certified OBGYN, member of the Institute of Bioidentical Medicine, over 20 years of experience in the medical field, specializing in menopause care. Thank God, we need more of you. Founder of dranat.com, offering personalized hormone therapy and coaching. And there's a very special concierge telemedicine service that you offer currently California, Florida, Illinois, soon to be Arizona. And your service is really special, I noticed, because you provide virtual consultations and really individualized support for women. Welcome, Dr. Anat. Thank you for joining us today.
Thank you, Lara. It's a pleasure to be here and educate more women on this topic because
It's vital.
it's vital, especially when you have only 7% of doctors feeling comfortable talking about menopause and only about 30% of OBGYNs. So I know. It's pretty.
Oh, that's interesting. I thought at least going to an OBGYN would guarantee you the resources and the support.
Not necessarily. So in the last 20 years, we've been in what I call the menopause prohibition, a period of time where menopause wasn't really taught in residencies. I was a resident in 2002 when the WHI study came out, and that study basically shook the whole world. And at that point in time, 40% of menopausal women in the United States were taking hormone replacement therapy. And the study comes out and says, you're going to get breast cancer from being on hormones.
Yep.
And so women stopped. And what we saw after that is the proliferation of a alternative market for supplements. The soy market boosted. We saw all sorts of like solutions coming up, like SSRIs for hot flashes, Ambien for sleep, as well as other sleep aids. And these are all bandages to try and alleviate some of the symptoms that we know are from perimenopause and menopause. And today we look at that study and it's been pretty much dispelled and disputed. It was a poorly made study. It was aiming to look at the effects of hormone replacement on women, but they didn't want to focus on women that had hot flashes. So they looked for women that didn't have hot flashes or were older, had passed that period of hot flashes. And so it was a study that included older women that had longer period of times already in menopause. It included synthetic hormones, Premarin and Prempro, both that are synthetic, meaning that they don't look the same as what the hormones in the body are. And so it's a very complicated story, but when you look at it, this one study that was not even peer reviewed before release changed how millions of women, 18 million women, stopped their hormones after 2002. And I was in residency, and I remember people coming in being desperate, saying like, I can't take this, but now I'm having all these symptoms. And, I didn't appreciate the symptoms of perimenopause, even though being a gynecologist and treating women, until I myself thought I had probably early signs of dementia 3 years ago. And I gained 30 pounds and was really moving downstream, not feeling well, and thinking that being on 32 years of contraceptives was treating my symptoms, because that's what we were taught in residency, that treating women with birth control was going to, alleviate the symptoms of perimenopause. And here I was, gained 35 pounds, wasn't feeling great, and had to look at alternative options. And when I stopped my birth control, which was the NuvaRing, within 2 weeks, I had the worst waking up in puddles of sweat and felt terrible. I tried the patch. It didn't work for me. I started developing little whelps around the patch. And so I needed to see what else is out there. And that led me to going down a rabbit hole of seeing what other things are out there. And I started looking at the holistic medicine and functional medicine aisles. And I met Dr. Rosensweet at a conference, and he is the founder of the Menopause Method. And I became his patient. And within 4 weeks, my brain was back to normal and I was feeling great. That's right, 4 weeks. And he put me on hormones, on bias, which is estrogen that has both estradiol and estriol in it, a natural progesterone, and on testosterone. And what's unique about the method that he offers is that it's put into organic oil, so it's all topical. And because it's an oil, you can easily titrate it weekly to levels that work for you. And so within 4 weeks, I was feeling great. Within 4 to 6 weeks, I was feeling even better. And I said, wow, you know what? I need to see how this works on others. And so I started doing that and eventually opened my clinic. And that's the same that I see in my own clinic. Women start feeling significantly better by 4 to 6 weeks, and it gets better and better. But that's using compounded hormones. So there's so much that I've learned on my deep dive that I'd like to share with you, some of those highlights. One is I never knew what a compounding pharmacy is. And most people don't. We're familiar with the local Walmart pharmacies, and those are your big box pharmacies that dispense pharmaceutical grade medicines. Compounding pharmacies are your corner store pharmacy where the pharmacist can make medicines that are unique for you. So let's say there's a patient that needs an anti-nausea medication that is an oral medication, but they're nauseous, so they're throwing it up constantly, right? They can take that medication and put it into another form, whether it's a rectal suppository or a transdermal cream or a patch or something, maybe drops, something different. Or if someone is allergic to an ingredient in a medication, the compounding pharmacist can work to make that medication without certain ingredients. And so these are really artists, and they get a really bad rep because they're compounding pharmacists. They are regulated very strictly by the FDA. They're more regulated than probably any pharmacy. They're highly regulated. So to hear doctors on Instagram say like, oh, compounding pharmacies are bad and all this stuff, it's, wait a minute, stop, pause, because clearly you don't know what a compounding pharmacist is or what they do, or how highly regulated their things are. I was also a doctor where the pharma reps would come in and they would tell us about the new drugs and they would be part of our education. And I question that now because I'm like, we need to look outside and we need to educate ourselves and continue to educate ourselves beyond what big pharma and the drug reps come into our offices and teach us, or teaching our patients on commercials all day long. So that was a big moment of seeing this whole other world that's available out there. And it's interesting because the other thing I learned during my deep dive is that not all estrogens are the same and not all progesterones are the same. And so, for example, progesterone, there's bioidentical, which is progesterone, like what your body has. And you can use the word bioidentical, body similar. Natural is really not a good term because Premarin, which also is natural, comes from horse's urine. That's natural, right? But they're all made in a Premarin pregnant mare's urine, right? And that was what was in the WHI. And later it became Prempro, Premarin plus progesterone. But my point is that not everything is the same. So it's like saying that all vehicles are the same, but we have motorcycles, we have trucks, we have cars. You wouldn't put a baby seat on a motorcycle. You wouldn't put a piano in a car, right? So they're all modes of transportation, but they're not the same. And so using the terms estrogen and progesterone are not the same. There's a difference between naturally occurring progesterone and synthetic progestins, which are in birth control pills, which are in many forms of Prempro, for example, that's a progestin, or using the term estrogen synonymously to include all estrogens, where what we have in our body is estrone, estradiol, estriol, and there's also a fourth one, but that is being debated from the placenta. But we'll stick to the three. Whereas in, let's say, birth control, the estrogen is in fact synthetic. That so you can't use them the same because the body doesn't see it as the same, you know. And so we have to like make distinctions between that. And I think that as a medical professional, as medical students, as residents, we're just interchangeably throwing in, oh, the progesterone, the estrogen in your birth control, but they're synthetic. But so to make a distinction between that is really important. And the other things that were big ahas for me in my deep dive into hormones is that testosterone is so important. We often think of testosterone as a male hormone. We as women have more testosterone in our body during certain times of our life than we do even estrogen. And so why would we not want to replace testosterone when that depletes? And so when I did my deep dive, and I like to simplify things, at some point in our brain connects with our ovaries and we start making hormones. We start making estrogen, progesterone, testosterone. And then we reach, that's puberty. And then we reach our fertile years of our 20s and 30s. And our estrogen, progesterone, testosterone levels are fairly level, even though during the month they switch, but overall they're pretty level. What happens next is in our late 30s, early 40s, for the majority of people, the progesterone and estrogen, testosterone levels start to drop. And the first one to drop is progesterone. And we have 100 times more progesterone in our body than estrogen. So if that starts to drop, the first sign we see are changes in our menstrual cycles. They start getting longer, shorter, irregular, infertility. Many women start to have problems with sleep. Many women start to feel anxious, anxiety. Progesterone is so important. It acts on the GABA and glutamate receptors in the brain and helps that to process. So as we get past our 40s, closer to declines. And as that decline occurs, and estrogen is also declining, but the ovary is making more and less, it's complicated. But as that decline happens, the ratio between the two sort of shifts, and we have what's called estrogen dominance. Doesn't mean that you have more estrogen. It's just that the ratio between the two switches. We start having difficulty losing weight. Many women will start gaining weight in their midsection or arm flaps, start having the changes in depression. We start having changes on our moods, changes in the way our brain functions, changes in every single organ in our body is affected by these organs, by these hormones. So we see more inflammatory bowel. Progesterone is very important for as an anti-inflammatory, as is estrogen. We start to see joint pain. We start to see all these things. And then testosterone also starts to decline. Testosterone also acts on the brain. It acts on the dopamine receptors. Those are the reward centers. So it's like that wow factor that you feel, in addition to making, when all these things are in the decline, you can't make muscle the same way. You're eating the same, but all of a sudden you're gaining weight. You're out of sorts. You're being passed over for that job promotion. More women quit their jobs. All these things happen. And it's like, what? This is like, mayhem is happening in our 40s, and what's happening, and much of this can be altered with the optimization, titration, whatever you want to call it, rejuvenation of the hormones, replacement, replenishment, all these words that are tossed out there. But by replacing that, we're addressing the core root cause of these symptoms. And
what struck me as almost like a lightning bolt was you're a doctor, you're very savvy, you're on the inside of treatments and interventions, and until you went through menopause yourself, and trying to get answers, and you've luckily found this doctor, and within 4 weeks you started feeling better, and remarkably better in 8 weeks. Like that is the everyone stop dead in our tracks and pay attention to what you're saying, because there is relief. And it's every time I do a podcast with a doctor, I learn a little bit more, but it is complicated. We're being served up on our iPhones a myriad of concerning, false, and marketing information that adds to the confusion, if you will. So, tell us about your process at your clinic. I've discovered you, and we're going to make sure that everyone in the states that you offer this service knows about you. But I discover you, and I make an appointment. What is the process to get feeling better in 4 weeks and then life changing at 8 weeks?
So there's several things. One is I have you fill out a very detailed questionnaire of symptoms, because those are symptoms that you might not even be aware of. That
Mm,
you're having, like
mm-hmm,
headaches, ringing in the ear, like also like dry skin, joint pains, things that like we don't typically associate with menopause or perimenopause. And the popular media likes to think about menopause like hot flashes, brain fog, vaginal dryness. And that's where there's
yeah,
so much,
my favorite.
there's so much more, right? There's so much more. So you fill out a detailed questionnaire. I meet with you. I send you to do some labs. I don't do hormone labs. I do look at your thyroid. I do look at your liver. I look at overall a whole bunch of labs, but I don't follow hormonal labs. And the
Mm-hmm,
reason why is it depends. If you're in menopause, your ovaries have shut down. And menopause is defined as 12 months, no period. Your ovaries are out, they're done. But it's important to think like when you're in perimenopause, that ovary is like a part-time worker that's on the way to retirement. Work, it's not showing up. So where are you going to catch it? Are you going to catch it on a day that it's showed up?
mm,
Are you catching it on a day that it's out the door when it's on vacation? Where are you catching it? So if you follow, there are women that have so many symptoms and yet their labs are fine. So what? Those women
mm,
just tell them that they're okay. Your labs are fine.
mm-hmm,
Sorry that you're having all these symptoms. Goodbye. No. Or if there are women that have such low levels, right? Because they caught them on that day, but they have no symptoms, or they might have all
mm-hmm,
the symptoms. So I
mm,
don't believe that treating the numbers. I believe treat the patient. And so we
mm-hmm,
go through
mm-hmm,
this together, and then I find right now I'm using the I, my right now my choice is to use the bioidentical hormones made in the 100% jojoba oil, because it doesn't have other solvents, toxic solvents often that are,
mm-hmm,
but there are creams out there. And I'm still learning and exploring what else is out there. I'm constantly learning to see what else is out there. I love the oils. I think they're a great option. They're made by a compounding pharmacy, and that's easy to titrate because they're transdermal. So I'm able to
mm-hmm,
titrate to levels that are appropriate for the patient. And then we meet several times, and you have access,
mm-hmm,
and we talk about it. If you're feeling like you need to go up or more, you talk to me. We go up steeper or less, and then we get you to where you need to be, and we constantly titrate you. And then if you're in menopause, what I also do is once we find a level that works for you, then I do a 24-hour urine to make sure that the levels
mm,
that I'm giving you are actually protecting your brain, your heart, and your bones. And so
yeah,
it's because
okay.
and I find that there's a good like 25% of patients that they feel fantastic. And then I look at their urine, I'm like, whoa, their levels are still too low. So where's that
Mm-hmm,
going to
mm-hmm,
put us down the line 20, 30 years from now? Because hormone replacement is not only about how we feel today and how do we relieve the symptoms that we have today. We have to think when you lose estrogen, your blood vessels become stiffer. Okay,
mm-hmm,
your cholesterol level goes up. The body knows that it wants hormones. And so the precursor, this was another big aha for me. The precursor for testosterone, progesterone, and estrogen is cholesterol. So think
Oh,
about cholesterol being an ingredient to make these hormones. But the ovary is like a bakery and it's shut down. And I'm constantly delivering more flour because I want more bread. But the bakery is closed. I'm going to end up with a parking lot full of flour.
oh,
It's what happens
yeah.
to many patients. Estrogen goes down, cholesterol goes up, your blood vessels are getting stiffer, you have more plaque formation, heart disease. Heart disease is the number one killer in women in menopause.
Yeah.
And we forget that because everyone is focused on breast cancer. Breast cancer is not the number one killer. The number one killer for breast cancer patients is what? Cardiovascular disease.
Yeah.
Well, what can we do to prevent that? What can we do to prevent dementia? What can we do to prevent osteoporosis? Is replacing these in the long term. And breast cancer is very important. We're women, we're at risk of breast cancer. We're exposed to the environment, we're exposed to toxins, we ingest toxins, we put toxins on our body, we drink them, we shower with them, we have genetics. There's lots of things that we're exposed to, and we have to worry about breast cancer and surveillance of breast cancer. But what we know is women that are on HRT and are diagnosed with breast cancer tend to have less aggressive breast cancers. They tend to fare better. And women who had breast cancer successfully treated and were put on hormone replacement have a lower risk of recurrence. So, prohibition of hormones and what kept us in a silo of not teaching the medical environment about these hormones is really a travesty. I feel that functional medicine and a lot of alternative medicine during the hormone prohibition continued to treat using compounding pharmacies. I use two types of estrogens. I use a bias. I use estradiol and estriol. And people say, well, why use two? And the easiest way I can explain it is estradiol is very potent. And think of it as like a dime. And estriol is weaker. Think of it like a penny. So instead of going up on a dose of estradiol and giving you 2 dimes, I could give you 11 coins. They're getting to other places in the body and helping with symptom alleviation, which is why my patients that come to me having been on estradiol patches and not doing well and still having, I convert them to a bias and they tend to do better and quickly because we can titrate them to a level.
So, Dr. Sapan, I want to circle back to something you said on how you work with your patients and how you get them on the right formulation for them, titrating up, they're feeling great, which has to be the best barometer for success because their symptoms have been alleviated. When you have them and you've measured their urine, well, you've evaluated your urine, too much talk about urine already, but when you get them to that point, does that then mean that some of their other potential risks of cardiovascular disease or dementia, are those mitigated because you're happy with where their hormones are at?
Yeah, so hormone replacement, estrogen replacement, we know can like help alleviate the brain symptoms of brain fog, but also long term with the risks of dementia. Now, there's other causes besides just hormone depletion that can cause other forms of dementia, but the majority that we see are going to be helped with hormone replacement. So we're mitigating that. We're mitigating the heart disease. We're mitigating the osteoporosis that happens. So a woman that enters menopause can lose up to 50% of her bone mass in the first 5 years. That's a lot.
Awful.
That's
Dangerous. Yeah.
awful. You know what was shocking to me, and I have to share this. I was on 32 years of birth control, and I did a DEXA scan just as like, hey, let me see where I'm starting at. And I was appalled to find that my score was minus 2.3, which is severe osteopenia. And I know that this is the result of being on birth control for so many years. So this is, again, some of the importance, and I can't emphasize enough that to make the distinction between synthetic, which are what we have in birth control, and these natural. So being on a progesterone and an estrogen now, estradiol, on a bias, estradiol, estriol with progesterone, I know that that's what it takes to build bone. So bone
Mm-hmm.
rebuilding doesn't need estrogen alone. You need progesterone. And
Okay,
progesterone,
right.
I feel, is the unsung hero. Everyone focuses on estrogen, estrogen, estrogen. As an OBGYN, we're taught if a woman had a hysterectomy, we don't need to give her estrogen because we give estrogen just to protect the uterus from the effects of estrogen. That's wrong. Progesterone
Mm-hmm.
is needed. It's needed for bone protection. It's needed for your mood. It's needed for sleep.
Mm-hmm.
It's one of
Mm-hmm.
the most important anti-inflammatories that we have in our body. And so
Mm-hmm.
I can't underemphasize the importance of estrogen, progesterone, testosterone as well. We need testosterone in
Mm-hmm.
our body, and my patients feel the difference. And I'm honored to say that I am learning from people who've been in the industry for over 30 years. The Dr. Rosensweets, um, Dr. Peterson, she Carol Peterson, she talks about progesterone and doses. Phyllis Bronson, so many others that Lindsay Berkson. There's so many doctors out there that are now in their 70s, 80s that are transferring this knowledge to a younger generation, and I'm so honored to be able to be on their shoulders.
Well, you're consolidating and then communicating out to audiences everywhere, including our community, on just what your learnings are and how women could apply it to their health journey. So you are in 3 states, soon to be 4, providing your services. So, it is a crime that there is not more of you and more support and resources and doctors available for menopause care. What's your advice to women where you don't yet have, that are in a state that you don't yet have services? What should they be doing right away to get themselves feeling as great as you did after 4 weeks?
So that's a great question. So I think the number one thing is to educate yourself,
Okay.
because the more educated you are, the more you can advocate yourself. Now, compounded hormones work great. Pharmaceutical stuff works great for a lot of people also. So I'm not saying one or the other. It all depends on what's your symptoms, what's your symptom relief. But you need to advocate. If a doctor gives you a patch and says, "Here, I'll see you in 6 months," and you go home and some of your symptoms have gone away, but you're still miserable, call them back. You need an
Mm-hmm, mm-hmm,
adjustment. Every woman is different. I don't, for me, it's a very tailored approach. And I know that it's not the approach for everyone. Some people because of location, some people because of finances. But at the end of the day, we have to educate ourselves and we need to advocate for ourselves and know that there are answers out there. And there are doctors like myself that practice out there. But even within the medical journey, you always need to advocate for yourself. So know what the symptoms are. There are symptoms trackers out there where you can
mm-hmm,
put your symptoms, know what you're being placed on. If you had, let's say, a hysterectomy, for example, and your doctor's like, "Oh, no, you don't need progesterone," educate them. You can read books like
mm-hmm,
Happy Healthy Hormones by Dr. Rosensweet is a great book. There are lots of books out there. The Menopause Mind by Dr. Mosconi, Estrogen Matters, Dr.
mm-hmm,
Ivan Bellamy. There are so many books, and the list goes on and on and on. There's books coming out every day. All
mm-hmm,
of these share the majority of what's in all of these is the same. That's the
mm-hmm.
symptoms, and that estrogen works, progesterone works, testosterone works. And advocate for yourself. If you're not feeling better, call your doctor again. If your doctor's not
Mm-hmm.
responsive, find another doctor that is. Because if your
Mm-hmm.
doctor tells
Mm-hmm.
you birth control is an option for perimenopausal symptoms, that's not right. You
Oh, I
know,
love that. It's very direct advice and it's
it's
literal, and we can do something with that. I think what we'll do is make sure that we have all your favorite book recommendations that we can put on our website. And I know you have resources on your website, and we want to connect our our community with your great insights into this important topic, because you will help a lot of women. We need to get you out there more.
Yeah, because what you do today is going to impact how you live your life
Hmm.
30 years from now, 40 years from now. Like I'm 51. The average age now of life expectancy in the US is what, 83? By the time I become
Uh,
83, we're going to be living into triple digits. Where are we going to
yeah,
be? You know, like how are we
right.
going to be? And it's advocate for yourself, advocate for yourself. That's all you can do.
Hmm.
And and it might mean read that great book, and when you're done, pass it to your friend or pass it to your doctor.
Yeah. Yeah, gone are the days that we have to be secretive and be feeling shame because every single woman on the planet goes through it, and we might as well help our sisters and our friends. And we need to be loud about what's giving us relief and where we're getting support. And as you've said, we can't advocate enough for our own health.
Well,
Health is wealth.
absolutely, health is wealth.
Mm,
I had my mom start hormone therapy at 73,
mhm,
and her sleep is better. She's feeling better. Her brain is functioning better. She swims an hour a day. That was like, but she suffered for 20
mhm,
years. And I wish I knew earlier what I know today so she
mhm,
wouldn't have had to do that. And that's why I say people have to go out there and they have to advocate for themselves. They have to advocate for their moms. And I'd like women to start advocating for the younger generation that is now
yeah,
using synthetic hormones. We need to put pressure on
mhm,
pharmaceutical companies to start looking for alternatives that use not progestins,
mhm,
not synthetic hormones, but hopefully more natural bioidentical or like teach people how to use diaphragms. We don't use diaphragms in this country. I don't know about Canada, but for my friends in Europe, they all use diaphragms, but we don't.
mhm.
I have never even seen a diaphragm in my life as an
Well,
OB/GYN.
they
So,
they're
but
definitely a thing. I know that they people in Canada use diaphragms. Just no. Well, anyways, Dr. Sapan, I loved our conversation. We definitely will circle back with you to see how we can help grow your audience, and you're giving our community such great insight. So thank you for joining us today.
you're very welcome. Thank you so much.
Thank you.